country comes to an end today. The government is expected to later in the day announce whether it will extend the curfew or will more stringent measures be declared in order to effectively combat the coronavirus pandemic. The cases of COVID-19 in the country continue to rise. And as we await the government's decision, I'm now joined by the Kenya Medical Practitioners, Pharmacists and Dentists Union Secretary General, Dr. Chibanzi Mwachonda. Doctor, many thanks for making time for us on Weekend at 1 today. The 30-day curfew and the partial lockdown of several counties in the country was aimed at slowing down the spread of COVID-19. 30 days post-curfew, what gains, if any, have we made as a country?
Yeah, so thank you for having me on the show. And so we are looking at, I'll start by saying that if you look at what is already shown on the screen, and that's the statistics currently, we have a total of 2.8 million cases across the world. Of these, 1.8 are active cases, and 1 million are cases that have already been closed, meaning that 80% recovered and 20% died. So over the past month that we've had a coronavirus pandemic in our country, what are we seeing? What we are seeing is that, one, we've gotten to a level where we are at local community spread. The second thing is that we are seeing every day that we get testing results, we do have a number of cases that turn positive. What does this mean? This means that at local transmission level, you still keep getting cases up until we get to a point where we stop getting cases at 0%. So as we speak, the measures have been able to mitigate in the sense that we are not having a large number of cases coming up. What you're seeing is a small increase in the number of cases. So we have slowed down our exponential increase in the number of cases, but that does not mean that we are already at the green zone. We're not at the green zone. And possibly what is going to happen is that we'll still have an extension of the curfew because it is important to have that. A good example is a country like South Africa currently that has been on lockdown for the past month. It was extended up to the end of April. And the last 2 days, on Thursday night and yesterday night, they've recorded a total of 500 cases in total, a jump. So, and they've been on lockdown. So that tells you that we are not yet at the green zone.
All right, and of course we had the address by the government yesterday, the Health CS. They're saying we have made significant gains, but people are returning to mass gatherings and seemingly returning to normalcy. So what you're saying is Kenya is not ready really to lift the restrictions. But let's talk about the numbers that we have been reporting compared to an international scale. How is Kenya in terms of flattening the curve in that manner? There are those who are quite afraid. The numbers being reported are not the real situation on the ground, solely based on the testing capacity we have as a country.
Yeah, so the first thing that really affects how we do the analysis is the capacity to test. And as we see, we are not yet even at 20,000 tests. In the country, our population is 50 million. So that determines how we analyze that. But if you look at the curve that we currently have in Kenya and you compare with the other countries, the difference being testing is that the other countries saw an exponential rise in that curve. Our curve is slightly on the lower side in terms of exponential increase, but if we did increase our testing capacity, then we'll be able to do a very good analysis in terms of those other countries and ours. But as we speak, we are at a very slow, steep increase. It's not as a steep rise as we had expected and what we'd seen in other countries like Italy, Spain, that now have got into flattening the curve. They're recording 0 cases as we speak.
All right, and I mean, the partial lockdown announced by the president seemingly aided in slowing the spread of COVID-19. But as we await the address from the government today, the question is, are we extending the curfew or are we looking at more stringent measures coming? There are counties like Nairobi, Mombasa, Kilifi and Kwale that have been termed the hotspots for the spread of COVID-19. The individual governors of those counties have now asked for total county lockdowns, if not total countrywide or nationwide lockdown. What, in your view, as a medic, should happen in these counties?
So as medical personnel, the reality is that the curfews so far and the restrictions put in place have been able to contain the spread. That's the first thing. So now we are reviewing and we are still hoping, to get what the total in terms of the measures that are put in place and the public health review. But in reality is we need to keep these measures in place and we need to stop the transmission rate. So that means that if we do go the total lockdown in these certain counties that are already hotspot counties, we need to also be careful in terms of ensuring that people are taken care of. People have food, because remember, a big population, a big percentage of our population actually is on the informal sector. People who go out every single day to make money and at least be able to provide for their families. So before we go for a total lockdown, because we might create another problem as we go for the total lockdown route. Yes, it is a viable option, but it has to be analyzed in totality, because you have to make sure that you sort out the economic problems of the people who are most vulnerable, and from there then now we ensure that we can go on the total lockdown route. So as we speak, yes, the current measures should remain as they should. The lockdown should be subject to ensuring that the vulnerable people are protected. And remember that we're also looking at other diseases and ailments with a total lockdown. We have to put in place measures that will ensure that mothers who are in labor, people who are suffering from diabetes and hypertension are able to access medical services.
All right. I mean, even among the most vulnerable, really, is those on the front lines of this fight against COVID-19. Earlier this week, nurses and a section of medics gave a 7-day ultimatum to the government saying they will go on strike if the allowances are not put in place. And let's talk about that, because that poses serious consequences in the country in the fight against COVID-19. Do you support that ultimatum to the government?
As a union, and I'd like to put this on record, the most important thing right now is to be able to help Kenyans. That's the most important thing for us right now. And yes, and I'm not saying that health workers on the front line should be ignored and should not be taken care of in terms of a compensation package. I think the timeline that was given for this compensation package was last week. The announcement was made last week. We've put our proposal to government in terms of allowances and a compensation package, in terms of ensuring that the healthcare workers have a group life cover. We've put those to the government. We are awaiting the final proposal that will be approved. So as we speak, what we can do and what we've directed as a union to our members specifically is that the Section 14(2) of the Occupational Safety Health Act gives the authority to the employee to step aside from a place of work that is hazardous and a risk to their life and danger to their life. So essentially what we're telling our doctors as KMPDU is that if the work environment is not safe, if you do not have the adequate and required personal protective equipment, take a step back, inform your immediate authority and the facility to provide the personal protective equipment that is required, and once that is provided, then you can continue seeing the patient. Do not put yourself in danger. But we will not say that the doctors as of now should actually leave their places of work completely. That's not going to be fair to Kenyans, especially during this time of the COVID-19 pandemic.
Many things. There is a KMPDU Secretary General Dr. Chibanzi Mwachonda there speaking to us as the nationwide curfew, dawn to dusk curfew, is set to come to an end today. Medics feel the curfew should be extended as we continue to flatten the curve. You're watching Weekend at 1, the very latest news. Take a short break, but do stay with us. More news, making headlines on the other side.